Welcome to The Point of Disorder. We're here today for another short, and we're very excited to have State Representative Carrie Rheingans, who represents the 47th House District in Michigan, which includes Ann Arbor, I believe. Welcome, Carrie.
Thank you. Thank you so much for having me.
We're excited to have you here. You recently introduced the HB 4407 to establish MiCare. What is MiCare? MiCare is actual healthcare.
It is like a universal option for Michiganders. I'm so excited about this.
Imagine that, Gina.
And I have to say, I went on your website, and under issues, it was just MiCare. I just love how you're just like out there, like, this is it. I'm getting this done. I don't care how long it takes. This is my jam right here.
Yeah, this is why I ran for office, was to pick up this bill and run with it.
So let's just talk a minute about what it includes, because I think everyone would be really excited to hear it, that it actually includes things like physical, mental, dental, vision, hearing, and prescription drugs.
Yeah.
Wow, talk about nice things. Tell us a little bit about the bill's journey, if you don't mind, Carrie.
I don't mind. So MiCare is a bill to establish a universal health care plan for Michigan, and it would cover all 10 million Michiganders. It would cover medically necessary services. So when a patient and a provider get together and decide that this is the treatment, these are the things that need to happen medically, that is considered a medical decision in medically necessary care. So MiCare would be administered by the state government and overseen by a board. The bill mostly deals with describing the board, and then the board's duties are to describe all the details down in the future. Mm-hmm. But the board and the details would not then step in and be like, actually, no, we're not making enough profits. We're just going to use some AI to deny your care. So we do not agree with that idea in our office. So MiCare would cover medically necessary services. Like you mentioned, dental, mental, because your brain's part of your body. Did you know? Your eyes also.
I think we could all
Your
agree.
tears, yeah.
We will all agree that my brain is definitely part of my body at the moment, although it's trying to fucking escape. But anyway, keep going.
Oh, that's really relatable. So MiCare was actually a bill that was introduced called Michiganders in the 90s. Ann Arbor State Rep then, Perry Bullard.
It's been around. I mean, I knew it's been around, like floating around these last few years, but since the 90s.
Yes. So in Michigan, obviously we have a long history of individuals who strongly support universal, sometimes called single payer, sometimes called Medicare for all type plans. John Dingell, the senior, actually introduced this in the 50s for the first time. John Dingell, the junior, actually introduced this again and again and again. And now Debbie Dingell has continued to help introduce this for years and years. So, I come by being obsessed with this, honestly, as an Ann Arborite. So in the 90s, Perry Bullard introduced MiCare. And, it didn't really go very far in the 90s. And then one of my predecessors, my district currently represents 4 previous districts with redistricting. So one of my predecessors, Yusuf Rabhi, who is now a Washtenaw County Commissioner, introduced MiCare in 2018. So that was the first time this kind of iteration in modern times, post-ACA world, was introduced as a state-level plan in Michigan. And so he worked on it for his time in office. And then when he was term limited and did not run again, I said, this is the thing I really want to do. Can I pick up your bill? And he said, yeah, do it. So we introduced it last term.
So I just want to point out, last term is when Democrats had the House and the Senate, and we have the governor. Right.
In Michigan, yep.
Yeah, okay.
And so...
slam dunk, no?
So not all Democrats are in agreement or have figured out yet that universal single-payer Medicare for all style care actually is the best way to go. So I worked for a decade in health policy. I actually helped roll out the ACA in Michigan and enroll thousands of people and make sure we had enough primary care providers in our community. So I have a deep understanding of this. I actually was a policy expert on panels with Debbie Dingell. Wow. When she would go around explaining in our community what the heck is in the ACA, I would be there saying, this is what the heck is in the ACA. And so through that experience, I realized, gosh, we need to do away with a lot of this administration, this burden on patients, these things that don't talk to each other. And so during that time, I got to know a lot of health policy experts who all told me, pie in the sky, if we were going to do universal healthcare, single payer style, we would have to start that way. Like, so we'd have to like get rid of our healthcare system and start over again to have it be paid like that. As we speak, as we're recording, the big bullshit bill, which is my personal nickname for it, is being final debate. And I suspect it will pass by the end of the day and be signed on the 4th of July, as President Trump wants.
So this brings us back to what Gina mentioned before, the very fact that you introduced this at a time where we had the trifecta, so we had the House, the Senate, and the governor's office. So you're telling me that we couldn't pass it then, even though we had all of that. So
yes. So the reason I was talking about the big bullshit bill is because it's going to break our healthcare system so much that we will have a chance to start over. And maybe we'll also happen to have a Democratic trifecta at that point where everybody does actually agree that we need universal single payer. So last term when we had a trifecta, part of the way we got there was from large donations from insurance companies contributing to many of my colleagues and the caucus. And that was something on top of people's minds as they were deciding whether or not to co-sponsor the bill or whether or not to have hearings on the bill. We had 0 hearings on this bill.
no hearings on this bill.
No regular hearings during the course of regular debate. So I had town halls all across the state, including the UP, Grand Rapids, Detroit, Lansing.
So I'm pretty sure that when you had those town halls, a majority of actual people on the ground, actual voters, constituents of all of these representatives that are in Lansing, would have agreed and said, oh my God, what I wouldn't give to be able to just go to the doctor.
Yep.
You know, there has been polling done in Michigan, and 80% of people polled have said yes, they want some sort of MiCare, some sort of universal health. It's widely popular. I don't understand.
It's widely efficient as well.
Yeah.
Well, it's cheaper. We all know that from the
Yep.
stats from around the world, we know that universal healthcare or single payer, whatever you want to call it, means that it's cheaper. We've spoken about this many times on the podcast.
In America, we pay more money than other Western countries for worse outcomes.
Yes.
So
it's cheaper overall as a overall amount of money that's processing through a healthcare system. But it's not cheaper for the people who want to make profits. So people who currently are making profits off of our profit-driven healthcare system, it will not be cheaper for them because they will not be making the profits they're making today.
Okay, so it's the shareholders we need to worry about.
let's call Blue Cross and Blue Shield, Julie.
Blue Cross and Blue Shield is technically a nonprofit.
You're kidding me.
Technically.
Oh, it's, yes.
What kind of a scam is that?
Well, they reinvest their profits in their CEO's bank account. So it's a little different than giving it to shareholders.
Wait a second.
Our non-profit isn't
We're
working
a nonprofit,
properly.
Julie. Come on.
We need to work this
Do
out.
we need like stocks? Can we buy back our own stocks?
If you have stocks, you're not a nonprofit.
Gosh.
Yeah, but we need to be putting
It's not a
money-
501c3 nonprofit the way you may think of.
Yeah,
Yeah.
we
other
just need to
nonprofits,
bonus
but-
ourselves.
I think that's what it is. That's right. We're doing it all wrong. Anyway, so basically, you made a comment there, which I think is really interesting. You're saying that you think we have an opportunity to basically take back the House and obviously keep the Senate in
Michigan.
In Michigan.
And also maybe,
maybe across the board, right?
in the U.S. Congress, we might be able to flip both.
And you think that if we do that, you think that your colleagues will be up for, and I have to point out that if you're listening to us on audio only, you really need to look at us on YouTube because Carrie is sitting here, number one, with a gorgeous pink jacket on and cradling her MiCare brochure, Healthcare for All. Yeah, there you go. So she came with the receipts. Anyway, you really do need to check us out on YouTube. So, but do you think it's on the back of what's happening, the big bullshit bill that's going through at the moment? Do you think that the reason that we might be able to take back the House in Lansing next year is because of that? Is that what you're saying?
That is one factor of why we'll be able to take back the House in Lansing in Michigan. Other factors include the Timu Trump speaker that we have. He's like a cheaper version.
He's a close friend of ours.
Yes. So he actually is really bad at governing and negotiating. Some of us knew that already. But, he is now realizing it in the mirror every day when he continues to fail. So I think he's not telling his members to be in their districts, getting to know people and hearing from them about what they want. Because what they would hear is that people don't want them.
Yeah.
They don't want their ideas. They don't want to force local governments to have an unfunded mandate to disappear and human traffic people to foreign countries. Because there are Republicans, especially the Nazi Josh Shriver, who is pushing that. So I think the House in Michigan will flip in part because of how terrible and awful many of the House Republicans are. They're not denouncing the big bullshit bill. They're not pushing back. They're not telling all of the people who are John James's constituents. They're just like, oh, guess we'll just do what Trump says, instead of telling John James, I don't know how you think you can run for governor if you're going to destroy one of the largest funding streams of our state budget.
We actually had an opportunity to run into him in person, and we asked him that. And it was just a bold-faced lie. He told us he was voting to expand Medicaid. Can you fucking believe?
To expand Medicaid.
The
Yeah.
nerve
So
of him
he
to
put-
just flat out lie.
He literally put the bullshit in the big bullshit bill.
Yeah.
He was
Yeah,
just talking
sounds like
bullshit.
it. Well, the DeVosses are going to get what they pay for.
Yeah,
that
that's true.
guy.
Sure.
That's true.
But we can look at Lisa McLean. Okay, she's in a very red district. 1 in 5 of her constituents are on Medicaid, and she's just out there so far up Trump's ass. She doesn't give a shit about her people. It's just what Trump wants, what Trump's legacy should be.
So, I mean, I'm interested to know, because you made the comment that in 2022, that a lot of the legislators, even the Democrats, got a lot of funding from healthcare providers and health
And
insurance
DTE and
DTE,
consumers and other major corporations.
So, do you think that either that won't happen this time, or that they'll think differently about taking that money?
I think that Blue Cross Blue Shield gave me a check for $250 in my first.
That's cheap. That's I'm sorry.
I'm just telling you, I consciously took it because I knew that it might not ever happen again on their side, and it hasn't. They know. But if they're gonna fund me, I'm gonna use the money because I used it to help get my staff and me all the way up to the UP to talk about universal health care. And so I think people will still take the money. It's just that they may actually find their spine because their constituents are going to go to their coffee hours and build their spine up one vertebrae at a time. And they're going to have a spine to do what their constituents want.
So it's fundamentally up to us.
Yeah.
As people on the ground.
Yes.
Constituents of these people. Hear that,
Voters,
people? It's
yeah.
up to us. It's literally up to us to hold these people to account.
Correct.
So one thing I know, Gina, you've mentioned in there that the Medicaid cuts actually don't come into effect until after 2026.
Yeah.
Right.
So that really comes down to we've got to be good messengers, right? Democrats have to be
So-
really fucking good messengers.
One thing that I have been talking with my colleagues about in Lansing and with my staff is that if we put ourselves in the mindset and the timeline of how the big bullshit bill is going to roll out, we're in calendar year, tax year 25, the last year of Trump's Tax Cuts and Jobs Act. And if we did not pass the big bullshit bill, people would, most of us have lower incomes, would notice a tiny amount of taxes. But in our day-to-day life, it would feel just like everything else is going up in cost. So it would kind of be minimal. Billionaires would notice a tiny amount of increase in taxes from 37 point whatever it is to 39. So like not even 2% increase in their taxes, but out of their billions. So like they literally won't even notice it.
I do want to point out that the tax cuts for billionaires in this bill go into effect immediately.
Yes, that's what I'm going to say. So when Trump signs this bill tomorrow, then it will keep those tax cuts that as we're currently experiencing, it'll keep them in place. So nobody will feel anything different. Nobody will feel anything different. Meanwhile, what's going to happen is SNAP benefits are going to start decreasing and school funding is decreasing. I think we're going to have food shortages this fall, which we can talk about all the reasons why I think that. But we're going to have other costs increasing, energy costs. People are going to get thrown out of jobs that are working on clean energy jobs. We're going to see a rush toward people needing unemployment in Michigan and needing Medicaid in Michigan. And so we're going to have some things that feel different in 2026. Not a lot, but we're going to feel some things that are different. So when people go online to do their Obamacare re-enrollment this fall, they're not going to have the subsidies that they had previously.
Yeah, they'll see those premiums.
And those
go up
premiums will be
thousands.
skyrocketing immediately this fall in only months. Insurance companies right now are going through their plans and trying to put their proposals to the state insurance approvers right now as we speak. So that's going to happen immediately. People are going to complain about that. People are not going to be able to afford that plans, so they will just go uninsured. So in the beginnings of 2026, there will be more people in nursing or in emergency rooms. There will be people having unchecked health issues. There'll be an increase in emergency services, urgent care. And when people get so much worse with their health and they go to the hospital, they have to stay there longer. And the hospitals will be more full and more full.
It's going to jam up the system.
With uncompensated care, with care that nobody's paying for. So then within that calendar year of 26, as things get worse and worse, insurance plans next summer are going to have to raise their rates 10. Senator Slotkin said, she was just talking to insurance folks, they're going to have to raise their rates 10 to 13%. So that's going to happen in the summer of 26 in those open enrollment plans and small businesses. Our Small Business Association in Michigan is already sounding the alarm. Their insurance premiums have gone up so much that Brian Kelly is starting to talk about it. And, you know, I agree with him. We need to do something about this.
Yeah.
Obviously, I think what we should do is have our healthcare coverage not tied to our jobs.
Oh, that's
and
a
so
lovely-
employers don't have to deal with negotiating contracts. They don't have to deal with the pool of risk of their employees. What if somebody suddenly gets diagnosed with an expensive disease? Then their costs go up. It's just, I would love to take that off your plate, sir. And let's make it just universal that you can leave a job, you can change jobs, you can start a business.
You can leave a bad marriage.
That's right.
If we had universal
Yeah.
health care.
So funny, when I first arrived here, one of my plans, I had this plan in my head, and I'm like, you know what? Wouldn't it be amazing? Can't you just go around to all of the big employers and just say to them, hey, I'm going to take this burden off you, and all you have to pay is like 1% extra in tax, and we'll use that money to fund universal health care. I was so
So silly,
naive.
Julie,
I know,
so
I was so
silly.
naive.
Well, the
but
question, there is still a question about how much it would actually cost. So my bill, 4407, is the policy bill that establishes the MiCare board, what their responsibilities are, what their terms are, how they do their budgeting on a 3-year cycle, that kind of stuff. We do need a companion bill for state level funding, which is basically a bill to tax the rich, which we're seeing is already getting on the ballot. People are collecting signatures for that for education purposes. I would love to do it also for healthcare purposes. But we will also need to have some sort of change in businesses not paying for healthcare, but instead paying a specific dedicated business tax for healthcare for their employees. We also, MiCare is precipitated on getting federal approvals. So that's another reason why the Democratic trifecta last term was like, do we really, think we're going to have federal approvals here in the last couple years of possibly a couple years of the Biden administration, who knows? So that's a little bit up in the air. Obviously with Trump, Dr. Oz, these folks are not going to give us federal approval.
Let's talk about that for a second. Why have that in the bill at all? Is that because we would possibly need federal funding?
So in Michigan, we get billions of dollars that come to our state from Medicaid, right? We put in some as a state, the feds put in some. That's billions. We also have billions of dollars coming in for everybody who's on Medicare. Those dollars pay for their health care, and those are federal dollars that, we're currently working people who pay Medicare tax are paying that. We're paying in right now. So my dad is on Medicare. I'm taking him to appointments very, very often with his multiple complex conditions right now. So the tax I pay to Medicare is actually helping pay for his today service. And so I would love for those dollars that we're all going to be paying through our payroll taxes anyway to be used for our state level plan.
It's got my vote.
So we do need federal approval for that.
Okay.
So luckily, for the past couple years, few years, not just a couple, there's been a national group called One Payer States. They have helped with drafting a federal bill called the State-Based Universal Health Care Act. They sometimes call it SABUCA. Not the best acronym, but You can call it Sambuca.
That sounds like a cocktail.
It does sound like a cocktail.
Not one I'd like to drink. I don't. Just
Have you had Sambuca?
Yes.
not a fan, but yeah, I have too many bad experiences. Sorry about that.
So
Sorry.
Sambuca is being introduced this month in Washington, D.C. Congressman Khanna from California and Senator Markey from Massachusetts are the chamber sponsors. And actually, I've been taking it upon myself this term to take things up a notch. If we're not going to get any movement in Michigan, then what we need to do is support this federal action as well as the federal Medicare for All. And I've contacted about 24 other state legislators who are the bill sponsor in their state for their state level Medicare for All or single payer or universal health care plans. And so many of us are going to Washington, D.C. to be there for the reintroduction of this and actually speak at a press conference with Congressman Khanna and Senator Markey and others to talk about why we need this bill, the State-Based Universal Health Care Act, in order for some of our states to do our plans. There are some states that have simply state-funded plans, and I cannot wait to talk to them about how do we do that. And
Please do. No, I know you were kind of doing this, I'll call it your MiCare tour, where you were, reaching out to legislators in states all across the country to talk about what they're doing in their state, what their bills look like, what's working, what's not working. What have you kind of learned? Are there any themes that, keep coming up over and over again as you talk to people in other states?
yeah, so the thing that I keep hearing is, we need to figure out how to put the funding together before we pass the policy bills. And so some states have established commissions or boards that their job is to study the financing and figure out how this might be funded. And so that is a good step.
But Michigan hasn't taken that step.
We don't have any sort of group officially doing that right now. One thing that my staff and I are doing with the state-based group called Michigan for Single Payer Healthcare is trying to work with them as a nonprofit to establish a fund where we can help fundraise into that fund to pay for a study. Obviously, earlier we said I'm based in Ann Arbor. There's a lot of health economists that work in town, a variety of institutions, some public, some private, we've kind of bid out, so to speak, an idea of how much would it cost to do a study like this in Michigan, to figure out how much it would cost and how much it would save. And we have some estimates that it would be in the six-figure range, very low six-figure range, that we would need to raise money to pay some economists to do such a study for Michigan. And it might be quicker and it might be cheaper to do this through fundraising through this nonprofit, as opposed to either trying to get a state earmark with my bestie, Matt Hall. That guy hates me so much, he didn't put, a literal health policy expert and one of the few legislators
High five, Carrie.
in the country.
He hates me so much that he takes off down the street at the sight of me.
There's
It's
a long
kinda
list
funny.
of people on Matt Hall's hate
Yeah.
burn book or whatever.
We're definitely on
I'm
that
pretty
list.
sure my picture is up on that wall.
Yeah, I mean, as long as he isn't directing his followers to shoot us, because that is something that
He's done that?
No, he has not done that yet. What I'm saying is, Trump kind of
Yeah, yeah.
has incited an
We do-
insurrection.
we do call-
So Timu Trump, how long is it going to take him?
Timu Trump, I love that. We do call him the little potato Trump. Yeah,
do,
because
yeah.
he kind of looks like
Yeah,
a potato a little
he
bit.
does kind of look like a potato.
He does, yeah. A potato in ill-fitting clothes. But at any rate,
So let's take a pivot and talk about what's happening in Lansing. Matt Hall is all of our favorite villains, but Lansing is kind of full of lawmakers who would sooner vote for corporate tax breaks than something like raising the wages or or MiCare.
and we know because we keep track.
Yes.
Yeah.
Are there moments where you just feel like you need to just scream into the void, or are people kind of quietly coming up to you and being like, yeah, I like what you're doing?
Both.
Yeah.
So one time when I felt like I needed to scream, I actually did just yell out on the floor while Josh Shriver was speaking, and I said, "You sound like a Nazi." And it was actually in the background. If you listen online, you can hear it.
Oh, I love that for you.
Yeah.
That's wonderful.
So sometimes I don't know, we hear a lot about maintaining decorum, but sometimes that is not as important as trying to fight these fascists.
I also very distinctly remember people like Angela Rheingans just sounding like screaming banshees
Yeah.
when she was, forced to work with a Democratic-led House. And
But also on top of that, let's be honest. At the end of the day, does decorum actually matter when you're killing people? Like literally, people are going to die
democracy
from
dies
this.
in decorum.
Exactly.
So as long as you're polite about it, is it okay to like take
So
away
that's-
people's health care?
That's
Is that
why I
where
still
we're at?
yelled
Yeah.
because I
Yeah,
don't
no,
think it's
I mean, I think
important.
it's fair game when you have a Nazi on the floor speaking.
Yeah, and the only reason Josh Shriver keeps getting speaking opportunities is because Matt Hall has to buy his votes for stuff because Republican policies aren't good.
Well-
And so they don't just vote for him.
Yeah, we've
So they need to like
noticed-
let people have their Nazi diatribe time in order to earn votes for bullshit bills.
When that happens, though, why don't we see? Well, I think you just answered this actually. We don't see it being condemned because Matt Hall needs that vote.
Correct. Matt Hall is platforming Nazis.
Yeah.
Because he needs their votes, because he can't fathom negotiating with Democrats. Matt Hall is very bad at his job.
Let's talk about negotiating with Democrats because just this week we saw the budget deadline blow past us because Matt Hall wasn't able to be effective in his job.
Right. So just to remind everybody, in 2023 and in 2024, we had a House proposed budget, we had a Senate proposed budget, and we had a governor proposed budget. We all negotiated the differences because there were differences and passed a final budget on time. Now, the governor is still the same governor. The Senate's still the same Senate. The only thing that has changed is the House and who's negotiating in the House. And it is Timu Trump. And so how do we square this? The only thing that's different, everybody else has experience doing this. So really, Matt Hall just can't do his job, you know? And he was in the news this week complaining that he couldn't pull off a couple Democrats because he doesn't understand.
He's just a whiny little bitch. that's
So,
all.
I mean, one of the things they put in their education budget was to fine school districts if there are pronouns in email signatures. That sounds like an email surveillance needs to be built. How much is that? And who's going to be watching that? I mean, it's just ridiculous.
But also, who does that fucking help?
Yeah.
Like, seriously,
Who does it serve?
You are a legislator. You are the people that we pay via our taxes.
Yeah.
You are the people that your constituents vote for. Which constituent out there, Timu Trump, is taking pronouns out of bloody email addresses from people, teachers and school administrators? Who is that helping? Which constituent is that helping?
Literally nobody. This is just to score the Timu Trump discount points, whatever. So they also did pass a budget. You know, the House passed a budget in March. I've been harping on this for months. It really annoys the Republicans when I call it a budget, but literally the nonpartisan House Fiscal Agency published their analysis and it said fiscal 26 budget. And then it cut 92%. It completely defunded the AG, Department of Ag, Labor Department, Environment, Great Lakes and Energy, and MDHHS. And then when you ask them about it, they say, we funded critical services, tiny bit for corrections, tiny bit for state police. But you know what is critical? Healthcare.
Oh.
I just literally
Yeah.
$0 in HHS means you don't care if a nursing home closes.
Right.
Nursing homes in Michigan will close within a week.
Yeah.
Not all of them, many, but not all, will close within a week if we have $0 in HHS. I mean, what the fuck? Critical services, my ass. So they already passed that. So they do have something, and they either say it's a stopgap or a starting place. If you're starting at zero and you're trying to get up to billions of dollars, I mean, come on. That is like an unserious way of doing legislating.
And funding police is not the most critical thing that we need to deal with here.
Well, if you're trying to force them to enforce federal immigration law,
Yes.
then, you know, maybe there's...
That's exactly what's
That's,
happening. As we noticed, the House passed a resolution from Josh Shriver, who basically wanted to urge local law enforcement to collaborate with ICE. Why? First of all, like our local police officers have, the time to just go and follow ICE around all day. But anyway.
Well, one thing you should know about that, which is not super clear from the video I myself took or the video necessarily publicly available online from the chamber, is that about half of the Republican caucus actually walked off the floor because they were very frustrated that Timo Trump was platforming a Nazi again, and they couldn't.
It's bad for the brand.
It is bad for the brand, and they're all complicit and supporting this. They're not stopping it from happening. So, I mean, sorry, maybe you could flip and be a Democrat, but so they actually didn't even have the majority of people on the floor to scream aye when they passed that. And we had all the Democrats, a vast majority, I think, of our caucus was there and screaming no. So if you actually counted the ayes and the nays, we would have defeated that resolution. But Rochelle Smith is the Speaker Pro Tem. She was up there and she just forced it through. But, she also wrote a letter that said, Michigan Republicans are 100% behind Donald Trump.
We
are in
that,
lockstep, or maybe goose step. I don't know.
She subscribes to all of his conspiracy theories, and we know she's the one doing the election integrity hearings.
Yeah, watch for her to announce soon that she'll be running for Secretary of State.
Really? Okay, interesting.
What else is
It's
she
like a
going to do?
Karamo 2.0.
Yeah, oh my goodness, one of
Because it's
our
all
favorites.
the same conspiracies and idiocy. Can I just talk about, you're one of the few lawmakers in Michigan who knows how to use social media. So first of all, I just want to say thank you, because simply just having your phone on the House floor, recording the shenanigans and helping to expose a little bit of what's going on is so needed. I feel like we have such a poor comms strategy in this state, but it's people like you who are using just a simple tool just to, expose what's happening.
But that's
it's so
part of
important.
transparency, right?
Yeah.
That's a part of being
Yeah.
transparent.
Yeah.
It's not illegal. We should all, once again, we're paying for it. We should all know what's going on. You're right, Gina. And I think the everyday person, we all carry one of those in our hands now. So, yeah, absolutely.
Well, I
Thank
will
you.
say there is a Lansing press corps. We regularly have folks from the Detroit News, the Detroit Free Press, Michigan Public. We also have the Insider, Bridge Michigan. Can't forget them, Advance, Michigan Advance, and others. So,
Well, but here's the thing, most people of a certain age don't take any of that in.
Right.
They are
And
literally
they're
getting
trying-
their news from social media. So when you make a
Michigan
reel,
Public has a TikTok account. I don't know if you knew that, but they do.
must be very small.
I'm sure it is. It's all elder millennials and Gen Xers, But anyway,
I'm glad
so-
they do, though. I listen to public
but they
radio
do
every
publish
day. Yeah.
videos and things.
Yeah.
But what I will say is the majority of the news that's covered in Lansing in the chamber is done by two insider news sources, Gongwer and MERS. And they are subscriber only. It's kind of expensive to get their
thousands
know.
of dollars.
Yes.
And they lean towards very
And
conservative views.
We get a subscription as lawmakers, and so we all read it pretty much every day. So that's one of the ways we talk to each other, which I find so immature and passive. I just don't operate in a passive way in any part of my life, if you ask my husband.
Explain
So-
this to us. How do they are in the comments section
No,
of
no,
a
no, no,
Mirror's
no, no, no,
article
no.
or what?
They plant
No,
stories,
no, no, no.
Gina. They
Yeah.
plant stories.
So
yeah.
I, as a lawmaker, they will answer my phone call, and I can say, "Hey, I'm hearing blah 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 blah, blah fake shit," and then you plant a rumor with one of those insider people, who then calls other people to try to confirm it. I'm just
And then it
trying to
becomes a
hear.
story.
I'm just trying to hear if this is real, and then people will not have heard it and be like, on background, I don't really know, but it sounds plausible, blah, blah, whatever. So they kind of confirm it, and then they all go talk to their little friends. So, people start rumors like that.
Okay.
And the news is used for doing this. This happened to me this week, where somebody called me to ask on background, and my response was, somebody's using you. Think about what their motivation is. Think about how they're using you. And also, if you want to talk on the record, here's what I will talk about. And then I talked for 10 minutes about the big bullshit bill. And now they're going to do research on hospital closures. The American Healthcare Association, which is the Association of Nursing Homes, self-reported that 27% of nursing homes will close should this bill pass. Also, I don't know if folks are aware, how does a lot of ambulance services make any money? They transport patients with kidney dialysis, needing kidney dialysis, stage 5 kidney disease, is a qualifying disability for Medicaid. So Medicaid pays for this. So ambulances are heavily dependent on Medicaid. So the more people who can't jump through the hoops of reporting their work hours every month and getting
Of course, you'd be
redetermined.
working a lot whilst you're having kidney dialysis every day. Yeah.
Why don't
Only
they
if you
work,
deserve
Julie?
health care, right? Is what these
Give them the
yahoos
work
say.
requirements.
That's
I
right.
love this. So we call that the Missy Elliott method, where you flip it and reverse it on them.
Yes, I do that a lot. But as far as being a person who uses social media, I am an elder millennial. So I do remember childhood with the modem and AOL Instant Messenger. But, I grew up, I had a college email address when you had to have a college email address to
me
get on
too.
Facebook.
Yeah.
So I was there when the first Facebook happened. And ever since I've been able to adapt to all the things, I am at the upper, I think, brain capability of doing TikTok. I've been talking to my colleague, Mai Song, who obviously is really good at TikTok, about some new methods, because I keep just doing these very unscripted, very unedited, talking to the camera
That's what makes them
things.
so great,
Yeah.
though. Stick with that. You don't want to be scripted.
But I don't want to be scripted, but I want to do some green screen stuff because I'm a health policy person.
Yeah.
Give me some data. Let me interpret
you
it
want
for
those
you.
overlays.
Yeah,
Yeah.
so I need
Yeah.
to practice that stuff.
Yeah.
But like I said, I'm an elder millennial. But I'm the oldest of all my siblings. My husband's younger, so I'm drawn into the millennial generation.
Good for you.
Just
Well,
don't do the millennial Zoom and you're all good.
What's the millennial Zoom?
It's when you're zooming in and you literally you do this on the screen to zoom instead of just cut and have the next segment closer up.
Oh, I mean, I don't really mind that if you're trying to emphasize a point.
Oh, well, Gen Z minds it.
Gen Z?
Gene is your gal if you want. All of this goes over my head because I am not an elder millennial. I'm solidly an X.
Millennials
Zoom.
are now the sandwich generation. I literally have to take my dad to an appointment at 7 a.m. this morning in Flint. Remember, I live in Ann Arbor. And then have to get home in time to take my kid out of camp at 4 in Ann Arbor.
I'm in the
what?
same position.
Yeah. Yeah.
I don't have time. I don't have time to cut and splice and click the thing
Yeah.
and edit it the right. Ain't nobody got time for that. Maybe Gen Z does if you don't have kids yet.
Well, they're not quite at the sandwich
Well,
generation.
if
that's
your
why.
kids are old enough, you can have them do it for you.
She's
Yeah.
not
no
old
more,
enough.
No more
Yeah.
camp. Just put them to work
Oh,
in
that's a
the
good idea.
digital war room.
We should do a digital war room camp.
I know
actually-
child labor is very popular right now in the MAGA world.
Well, I've been thinking of actually doing some interviews with my 8.5-year-old and having her ask me questions about my job or what is why are Republicans doing this thing, and kind of seeing how she asks about it, because I think she gets actually some of what's going on.
Yeah.
And it would be very interesting to hear what questions she
probably
has.
gets it more than most people, quite honestly. If she's around you, and I'm sure that she has kind of an insight. Hey, I'm interested to ask you, in terms of the upcoming elections, so we've got the midterms coming up. So if indeed we are able to, flip it and get the House back and hopefully hold on to the governorship, that would be fantastic as well. What do you think? I mean, I think I know the answer to this from your perspective, but overall, what do you think the legislative priorities will be for Democrats if that happens?
So we are going through a process right now in the House of using our coffee hours, doing town halls in our districts over the summer while we're in district, and hearing from folks on the ground, what is your top priorities? We already know the top priorities are all basically economic, but I kind of want to think about it in a past, present, and future type mindset, right? What do we need to protect from the past? We need to protect our rights. We need to protect our advancement in voting rights and civil rights, LGBT rights, things like that. What do we need to fight in the present, right? What is it that we need to be focused on right now in the present? One of the things we're going to have to deal with is figuring out how to make as most efficient as possible, requiring people to report they're working, right? So that is something that's going to be forced upon us, and we're going to have to figure that out. So Democrats take the tact of, great, then let's put caseworkers, community health workers, every corner of the state, figure out how to help people walk through this. Let's make an app. Let's figure out how to make it internet accessible and web, phone accessible. Can you text your number, your office hours in? So Democrats solve problems, right? That's the kind of thing we're going to be doing in the present, solving the problems that the Trump administration is forcing upon us. and we also need to look to the future, right? So we need to figure out what are we going to be doing and what are we for. Democrats are for clean air, clean water, clean soil to grow our food. Democrats are for universal health care. We want everybody to have health care. Democrats are for making sure that our communities are safe. We want to make sure that in the future we have educated workforce. We need to make sure we have universal public education that is high quality. We need to make sure that we have access to college. So these are the things that Democrats are for into the future. And so we need to think about what do we need to protect in the past? What do we need to fight right now and make less bad? And then what do we need to go for in the future? And I think it's pretty clear we all have different specific policy ways we'd get there on universal health care, for example. But I know I'm pushing for a publicly financed, publicly administered healthcare system that uses private providers, but uses public funds, because this is the kind of thing that we all need. Every day we wake up, we all need roads. We all need water to run in our pipes. We all need to have clean air to breathe. These are things that I can't just pay for myself as a taxpayer.
Basic human rights.
Yeah.
Rep Rheingans, for folks who want to help get MiCare on the books, what can they do?
Well, I do have some MiCare information on my official website, which is reprheingans.com, which is my taxpayer-funded and managed website. And then I also, on my campaign side, have carriewreingans.com. I have a whole tab where we have information about MiCare. So that's how you can learn more about it. We are asking folks to consider a couple things. We are, if you look at the back of the brochure, we have a long list of supporting organizations that have passed resolutions or otherwise gone on the record officially voting in support of MiCare as a policy. So we ask organizations to do that. If you have like a church group, a book club, or some sort of group, that Rotary, whatever, that can pass a resolution. We're also asking folks to invite us to do a town hall or discussion with a group, with your group, whatever group it is, church, book club, like I said, but also it could be with your union. It could be with just your Democratic club, whatever. So, I mean, we're going to be doing this up in the UP in a few different places across the UP in a couple weeks here. So please invite us to do that. Talk to your state representative and see if they want to invite us officially as a colleague, right? Some representatives, like all the UP representatives are Republicans, they don't want me up there, but community groups are inviting me. So I can still go and do it. And then lastly, keep your eyes peeled for us announcing where you can donate to help fund that study that will help us determine how much this is going to save here in the state of Michigan. And then, of course, if you want to keep me in office, you can always donate to me. CarrieRheingans.com, there's a link. But
try and cover that $250 that Blue Cross
yeah.
Blue Shield gave you.
I hope
I
you
also
used it
don't
to
take money
print
from
out.
DTE or from consumers.
I think if Blue Cross offers you money, you should take it and use it to print these out.
Yeah, well, these ones are taxpayer funded. So thank you, taxpayers, for helping me get the word out about what MiCare covers and what it will take. And on the other side of life, I do use those funds to support, like me and my staff. We're going to be going up to the UP. We have to pay for gas and
Right.
hotels and stuff. So that's where the non-taxpayer funded funding comes in helpful.
Carrie, I just want to say it is so refreshing to have someone in here that your response to what the priorities are going to be if the Democrats take the House was so thoughtful and so honest. Thank you. All I can say
you are
is
welcome.
thank you.
I think most Democrats could say the same words. I really do think they could. I just think people are still reeling from last election and trying to figure out which fires are we putting out right now.
Yeah.
You know, we do need to do all of those things.
Yeah, I mean, it was just thoughtful. So thank you very much. And thank you
Yes,
for
you're
all you
welcome.
do. We at Distill Social will be, in Point of Disorder, will be like cheering you on.
Oh, thank
and
you.
hopefully be able to do a little more than cheer on at some point in the game. But thank you for joining us, Carrie. And
Thank you.
don't forget, if you're interested in hearing more on Point of Disorder, please make sure, or sharing this information with other people, please make sure that you follow us, you like us, you give a 5-star review and an actual review, and we might at one stage give you a shout out. So thanks for joining us at Point of Disorder, and we'll see you next week. Bye.
Bye.
And that's a wrap on today's episode of Point of Disorder. We'd like to extend a huge thank you to everyone who listened today. And if you like us, give us a like, a subscribe, or a review on any place you get your podcasts. And don't forget to follow us on social media at Distill Social and at The Guerrilla Politic. This is the Point of Disorder podcast, signing off. Stay sharp, stay progressive, and above all, stay tuned.